The initiative is called Healing Inside and Out, Massachusetts Tobacco-Free Hospitals. Hospitals are stewards of the public health, and tobacco use is the leading cause of preventable death in the United States. So this is a voluntary initiative, but one that we take very seriously, and we're doing it in collaboration with the Massachusetts Department of Public Health. Working with them, the state and the healthcare providers together is really an important and powerful step, I believe. We've developed a logo for our initiative, which you can see. It's a very upbeat, healthy-feeling logo. It's the traditional H sign that stands for hospitals across this nation, but it has the elements of clean air and greenery to symbolize what healthy breathing and healthy living can be all around, and how we can create a healthy environment, not just for our external environment, but internally for our bodies as well. So with that, I'd like to turn this over to the Commissioner of Department of Public Health, a real partner, someone I've enjoyed working with immensely here in Massachusetts. Their support, he and his staff, we're very grateful for it, and I'm going to turn the podium over at this point to Commissioner John Auerbach.
Thank you very much, Lynn. Today, I think, represents another example of the remarkable leadership of Lynn Nicholson heading up the Massachusetts Hospital Association. And the Hospital Association does terrific work in terms of being on the cutting edge of taking steps to improve the health of the residents of the Commonwealth. And that's not surprising, I think. It's wonderful that the association is taking the lead, but given the great work that hospitals do throughout Massachusetts to promote health, it's really natural to expect that hospitals will be in the lead of working on issues like tobacco control. I want to talk for a minute about why is this such an important issue. At the Department of Public Health, we look at all of the health issues in the Commonwealth of Massachusetts, and truly tobacco use is still at the top of the list of health problems that we face in Massachusetts. We've made progress, and we're down now to about 15% of the adults in the Commonwealth smoking, down from mid-20s just a decade or so ago. So we are making progress, but 15% of the adults in Massachusetts is a very large number. 16% of adolescents in high school smoke. And what we're seeing in high school students is more and more use of a variety of different tobacco products. So it's very concerning to see the continued use of tobacco products when we know that these products end up in deaths, thousands of deaths each year in Massachusetts, and tens of thousands of people who have serious medical conditions. So tobacco remains a very serious concern, and it also, as Lynn said, is one of those concerns where it's preventable if we take aggressive steps to try to address the issue. Another reason I would just say we need to pay attention to this issue right now is, as everyone knows, with healthcare reform, there's an enormous focus on the cost of healthcare. And the best way to reduce the cost of healthcare is to prevent people from becoming ill. And so if we invest in innovative approaches like the Massachusetts Hospital Association's initiative, we're likely to reduce healthcare costs in the very best way by keeping people healthy. We also know that around tobacco in particular, we've seen a lot of changes in over the last couple of decades in what's considered the right standard of care. 20 years ago, as my father was in a hospital dying, down the hall from his bed, on every floor in his hospital, people visiting patients were smoking. The patient rooms, the patient family rooms just allowed smoking as part of routine care 20 years ago. Now, there's not a hospital in the country that would have that would allow smoking on a floor where patient care occurs. It would be considered outrageous, but 20 years ago, that was the norm. As little as 10 years ago, we had smoking in bars and restaurants in Massachusetts, and again, when we were proposing that those changes occur, people thought, it can't happen. Now, you can't have a bar that would operate or restaurants that don't have smoking sections. Now, in Massachusetts, It's the norm. If you walked into a bar or restaurant and saw someone smoking, people would be outraged now that it's just inappropriate behavior. And that's what we'll see with this initiative that the Mass Hospital Association is undertaking, that the entire campuses of hospitals will be, the norm over the next few years will be no smoking at all. And the fact that almost 40 hospitals in the Commonwealth are there already, no smoking, not just within the hospitals, all of them are there, but in the parking lot, in the surrounding area, in the garages, anywhere on the campus. That's what MHA is proposing together with us in this initiative. And again, it will be just a few years before that gets to be the norm. But it takes leadership, it takes going out in front, it takes courage, and we really have that with Lynn Nicholas and MHA, and with those other 39 hospitals that have shown it can be done. Our staff at DPH, Lois Keithley and Eileen Sullivan, have really done terrific work in terms of advising how best to work on these kinds of initiatives, and importantly, how to pay attention to offering smoking cessation classes and support efforts to try to help the staff of hospitals give up smoking so that they can be good examples for the patients and the patients' families about how this can be done. So working together with the staffs of the hospitals is an important way of demonstrating that we know how to do this by offering support, by linking people to the right services. Spaulding has been the model hospital in terms of showing how to do it and do it well. So DPH is very happy to be a part of this, very happy to work in partnership with MHA, and we're certain that this initiative is going to be very successful and will probably be, in just a year or two, coming together again to celebrate the increasing number of hospitals that have made their entire campuses tobacco-free. Thanks.